1,000 Americans struggle with autoimmune disorders like Crohn's disease. But new effective treatments are really just right around the corner. Here to tell us about some of the advancements in treating these diseases is Dr. Robert Jones from Intermountain Medical Center. Thank you for being here today.
Thank you.
So what is an autoimmune disease?
An autoimmune disease is basically where the body can't tell the difference between self and not self. So if you have an infection of the colon or the small intestine, then it can often trigger an immune response, and that immune response can't turn off. And so that's what happens in these diseases.
So if someone has one of those autoimmune diseases like Crohn's disease, what are some of those symptoms that they'll start experiencing?
They can have rectal bleeding, diarrhea, abdominal pain, fatigue, joint pain.
Wow. So a lot of symptoms. And I mean, when someone has diarrhea, they think maybe I just ate something I shouldn't have been eating, or, you know, how do you know if it's Crohn's disease or something that you should go see your doctor about?
We all have periods of diarrhea in our life, throughout our life, but if it lasts more than 2 or 3 days, then you should start becoming concerned. There can also be infections in the colon, like Clostridium difficile, that needs to be treated. So if it lasts more than 2 or 3 days, I would talk to your doctor about it, or if there's bleeding, or if there's abdominal pain, fevers, those type of symptoms.
So what's the first step? Someone comes in and they say, okay, I've had these symptoms for quite a while now, maybe a week or so. I think something may be wrong. What do you do first?
Typically we order labs, and we often stool studies, and then a lot of it depends on the degree of their symptoms and how debilitated they are. And if there's alarm features like they're having bleeding, they have a family history of Crohn's disease or ulcerative colitis, then they will have an endoscopy, typically like a colonoscopy. And there's also other tests we can do, MRIs, CT scans, capsule endoscopies to make the diagnosis. So
once you find that, yes, this is what that person has, how do you treat it?
There's many treatments for Crohn's and ulcerative colitis, and a lot of it depends on how severe it is. It can go from simply taking a pill, or it can be a biologic therapy. And often these treatments require monitoring by the physician. And one thing we've done at Intermountain Medical Center, which I think has been very beneficial to our patients, is develop a multidisciplinary conference. Similar concept as you would have when treating cancer patients. So you have radiologists, pathologists, gastroenterologists, surgeons, and we have conferences once a month that we present patients and develop a treatment plan.
Got it. So you're all working collectively to provide the best practices and the best treatment. June 5th, right? June 5th?
June 6th.
June 6th. Yeah. June 6th, there's a walk that's coming up, and this is a great place for people with an autoimmune disease to come, and also viewers, other people can help out as well.
Correct. Basically, it's a Crohn's Colitis Foundation walk. It's from 3 to 6 p.m. at Wheeler Park. And the goal is to raise money for the Crohn's Colitis Foundation. This is an organization that gives $220 million a year for Crohn's research. And so they're very important in helping us understand the disease by providing money so that we can do research.
Absolutely. So you need to do the research. You have to have the funding for that. We'll put the details on our website at goodforutah.com on how you can participate in that walk and learn more about autoimmune diseases with Intermountain Medical Center. Dr. Jones, thanks for joining us.
Thank you so much.
And we have